Hi everyone, and welcome to webinar 9 in our Data Exchange webinar series for the Targeted Earlier Intervention program. In today's webinar, we are going to talk about measuring outcomes for individual clients. So as always, there are 3 key things today's webinar will cover. We're going to talk about anything and everything about measuring and reporting individual client outcomes. First, we'll talk about what outcomes actually are and why we need to measure them. Then we're going to talk about SCORE, what it is and why we need to use it. And then we'll also talk about how to actually use SCORE to measure and report client outcomes. I'll go through an overarching process to do this, and I'll also show you some concrete examples so you can see what it looks like in practice. In our previous webinars, I introduced everyone to this document, the Data Exchange Quick Start Guide. This is a 5-page document that outlines the 11 key steps you need to follow to access and start using the Data Exchange. It includes links to all the key resources you need to action each step. And as you can see on the slide, there's also a checklist so you can keep track of what you're up to. So in each of our webinars, I've been taking everyone through each step in this document. So as you can see, we've worked our way through getting onto the Data Exchange, we've entering our data, and now we're up to step 10 to measure and report client outcomes. So like our last few webinars, we've split this step into 2 different webinars because measuring outcomes is quite a mammoth task. So in today's webinar, we're going to cover using SCORE for individual clients. And then our next webinar will focus on using SCORE to measure outcomes for groups or communities. So, first thing that I want to discuss is what are client outcomes? So, client outcomes are the changes your service hopes to achieve. So these may be changes in your client's knowledge, their attitudes, their values, their skills, or their behaviors. And they could be outcomes for an individual person, for a group of people, for a family, or for a community. So there are 9 high-level client outcomes that the Targeted Early Intervention program is working towards. You can see these in the table on the right-hand side. So we've got things like increased client-reported self-determination, increased school attendance and achievement, sustained participation and employment. And then we've mapped those outcomes to the New South Wales Human Services Outcomes Framework. So you can see there are 7 different domains, and these include things like empowerment, education and skills, social and community, safety, health, etc., etc. So these are the outcomes that the TEI program as a whole aims to achieve for children, young people, families and communities in New South Wales. So in your TEI contract, you've identified one of these domains and one of these outcomes for each service type you deliver. So these are the high-level outcomes that every single person here today is contributing to in some way or another. So in our webinar, I'm going to show you how to measure and report these outcomes for the work that you do on the ground with clients. Before we do that, I want to talk a little bit about why it's important to measure outcomes. So measuring client outcomes can help us understand the effectiveness of our services and if our clients are better off after receiving a service. Client outcome data shows us if our clients have achieved their goals or if their circumstances have improved. So we can use this information to improve the services we deliver to ensure our clients receive the right service at the right time. We can also use this information to build our local evidence base of what works. So we can evaluate our programs and our services and identify activities that achieve the best possible outcomes for our clients. So there is an end game to all of this data collection and reporting. Please don't think that it is just some compliance exercise. It's really about making sure we're all making a positive difference in our clients' lives and we're giving them the best service possible to improve their situation. So in the data exchange, in order for us to report outcomes, we're using this thing called SCORE. So SCORE is an outcomes reporting tool that the Data Exchange uses, and it stands for Standard Client/Community Outcomes Reporting. So it allows us to report client and community outcomes and satisfaction. So you can see on the slide, there are 4 different types of outcomes that are measured through SCORE. There's circumstances, goals, and satisfaction score. These are used to measure outcomes for individual clients. So the individual people who have their own client record in the data exchange. Community score is used for large groups or communities. So when it's not possible to get information from all the people who attend your community event, for example, you can use community score to report an outcome for that activity. I just want to talk about this in a little bit more detail because I know some people have been getting confused about which score to use in specific circumstances. So in the data exchange, we spoke about this in the last 4 webinars. There are 2 different types of clients we can report. So there are individual clients. So this is any person who participates in an activity you deliver. You've collected personal information from them and you've created a client record for them in the data exchange. So we've got some examples on the slide there. So you'll most likely have individual clients for things like playgroups, counseling, parenting programs, home visits or case management, group activities like a youth group, a parenting group, a school program. In your drop-in center, you might have a little homework club. The kids who attend that could also be individual clients. You will really have individual clients for any activity where you expect to see the client more than once. And you can use score to measure outcomes for those clients. So the type of score you will use will be circumstances, goals, and satisfaction. And I'll take you through all of that in today's webinar. The other type of clients we can record in DEX are unidentified groups. So this is a large group of people who receive a service, and it's not practical or necessary to collect individual client information from them. So instead, you just record the number of people who participated in the activity. So you can do this for things like a community event, a one-off information session, or interagency meetings. So when you just record the number of people who have participated in the activity, it's obviously not going to be possible to measure outcomes for those people individually. So what you can do instead is you can use community score to measure an outcome for the group. I am not going to discuss community score in any more detail today. We're going to spend an entire hour talking about that in our next webinar. Today, we're going to focus on reporting outcomes for individual clients. So if you if you're not interested in measuring outcomes for individual clients at this stage, please go to webinar 10 that looks at community score, and that will hopefully answer all of the questions you have about that. So the first type of score that I want to run you guys through is called circumstance score. So the name of it is quite on the nose in the sense that it is used to report changes in client circumstances. So there are 11 different domains that can be used to capture these changes. You can report changes in their physical health, their mental health, family functioning, their employment situation, their housing status, anything that these 11 domains cover. You do not need to report outcomes for every single domain. You just need to pick the domains that are most relevant to the service you deliver. So say, for example, you deliver a playgroup, you might report an outcome for the child in the age-appropriate development domain. And then you might report an outcome for the parent in the community participation domain. But you wouldn't report outcomes in things like financial resilience or material well-being or housing because your playgroup isn't actually addressing those needs. So you just need to focus on the domains that are most relevant to your activity. So in order to report circumstance score, there is a 5-point rating scale that we use. So you can say if a client's mental health, for example, is very poor, poor, moderate, good, or very good. The next type of score is goal score. So we can use goal score to report if our clients are achieving their goals. So there are 6 different domains we can use. So we can report if a client has improved their knowledge, their skills or behaviors. We can report if a client is more empowered, if they're more engaged with relevant services. And you can even report about the impact of an immediate crisis. So again, you do not need to report outcomes for every single domain. You just need to pick the domains that are most relevant to the service you deliver. And goal score also has a 5-point rating scale. So you can say if someone's behavior, for example, is very poor, poor, moderate, good, or very good. The last type of score that we can use for individual clients is satisfaction. So this very obviously enables us to report if a client is satisfied with the service they received. So there are 3 domains. The service listened to me and understood my issues. I'm satisfied with the services I have received, and I am better able to deal with the issues I sought help with. You can ask clients all 3 of these questions or just 1 or 2. It's entirely up to you. And this also includes a 5-point rating scale that ranges from disagree to agree. So clients can say where they sit on that 5-point scale in relation to those questions. So quick little recap. There are 3 different types of score we can use for individual clients. For circumstance and goal score, you just need to pick the domains that are most relevant to the service you have provided. And you can use any combination of circumstance and goal score together to report the impact of your service. So say, for example, you have someone come to your centre and they're experiencing domestic violence. You might use the domain personal and family safety to report how safe they feel. And then you might also use the domain impact of immediate crisis to report how that crisis is impacting them and if it lessens over time. And then for satisfaction, you can just ask clients to answer 1, 2, or all 3 of those statements. It's entirely up to you. So what we are going to do now is we're going to go through this process to actually use SCORE in practice. So as you can see, there are 6 key steps that we've identified. The first step is to identify your client outcomes. You can't measure anything until you know exactly what it is that you're trying to achieve. And then once you've figured that out, there are 5 more steps you need to follow that take us all the way up to recording our outcome in the data exchange platform. So I'm going to go through each step in this process. I'll explain what it means and how to do it. And I'll show you some concrete examples along the way to show you what this process looks like in practice. So the first thing you need to do is identify your client outcome. So you need to think about the purpose of your activity. What change do you expect to see in your clients? What goals do you want them to achieve? What difference is your service going to make? When you do this, you should identify 3 specific things. The first is the New South Wales Human Services Outcomes Framework domain. So you can see on the slide there are 7 domains to choose from. And you just need to identify the domains that are most relevant to your activity. So you can just pick 1 domain, or you might have 2 or 3 of them. It will depend on the activity you deliver. Once you've done that, you need to identify the TEI program client outcome. This is going to be really easy because once you've identified your domain, you can already see what the TEI outcome is. So if your domain is empowerment, for example, the TEI outcome is going to be increased client reported self-determination. So what we can also see is that those outcomes are quite broad, they're very high level. So the next thing you need to do is you need to come up with a very specific outcome for your group of clients that your service can directly achieve. And this is called your service level outcome. So if you run a 12-week program with a group of parents, what kind of things do you expect those parents to be able to do at the end of your program? If you run some workshops in a school with year 6 students, what kind of changes do you expect to see in those kids at the end of the term? They're the kinds of things you need to think about to come up with your service level outcome. So here are 3 different examples to show you what we mean. So say, for example, you run an after-school art program with Aboriginal school children, and the purpose of it might be to connect those kids with their culture and to ensure they feel like they're a part of their community. So the most relevant HOSOF domain is probably going to be social and community. Then we've got our TEI outcome, which is increased sense of belonging to their community. And then we've got an outcome that is specific to our activity, which is to increase connection to community. So you can see how we're really drilling down to the key purpose of the activity. And hopefully at the end of your art program, you'll be able to see that those kids are more connected to their culture and to their community. Another example might be for an in-home family capacity building program. So for families that have children who may be at risk of abuse and neglect, for example. So the aim of this program could be to support parents and carers to keep their children safe. So the HOSOF domain is very likely going to be safety. Then we've got our TEI outcome, which is to reduce risk of entry into the child protection system. And then our specific outcome is that children are safe with their families. So again, we're really drilling down to the key purpose of the program. Now, please bear in mind that these are just examples. When you do this for your own work, you might find that there are 2 or 3 domains that are relevant to the work that you're doing. And you might end up with 2 or 3 specific client outcomes. And that's more than okay, just so long as the outcomes are directly related to the activity you're delivering. So once you've identified your outcomes, you can move on to step 2. So in step 2, we need to identify which score domains we would use to report those outcomes. So we need to go back to our list of circumstance and goal score and figure out which ones are most relevant to our activities. For some activities, this will be really obvious. For others, it might not be. So we have developed this table to help everybody figure this out. So you can use the information in this table to figure out which score domain is most relevant to you. So to start, let's just take a look at the first 3 rows in this table. So at the top, you can see we've got the 7 HOSOF domains across the top of the table. Then we can see the TEI program client outcomes, and they all sit under their relevant domain. And then the next row, row 3, includes a short description for each outcome. So it describes each TEI client outcome in more detail to help you understand if this outcome is relevant to your service. So for example, in the education and skills domain, the TEI client outcome is increased school attendance and achievement. The description for this outcome states children and young people are supported to attend and engage in school. However, in TEI, we don't just support children and young people to achieve education-related goals. So the description also says people are supported to participate in education and develop skills. So this means that this outcome is relevant to all people, children, young people, and adults who are trying to increase their education and skills in some way. So please take a look at those descriptions if you're ever a bit stuck trying to figure out what domain to use. And then underneath that description are the circumstance domains. So we have mapped the circumstance domains to the TEI outcomes to help you figure out which domain you should use to report your outcomes in the data exchange. So you can see in the social and community column, there is the circumstance domain, community participation, and networks. So this means if an outcome you're trying to achieve falls into the social and community domain, you will most likely use the community participation and networks domain from circumstances score to report that outcome. The next row looks at the goal score domains. These are a little bit trickier. As you can see in our table, the 6 goal score domains actually sit across all of the TEI program client outcomes. So this means once you've identified your outcomes, you should look at each goal score and see if it's relevant to your activity. And then the last row shows some of the validated tools you can use to measure outcomes, but we'll go through this in more detail later. So to continue with our previous example, I've added some information to this image down the bottom. So we identified earlier that our art program for kids is focused on increasing connection to community. So the most relevant score domain for this is the circumstance domain, community participation and networks. The example in the middle is for an interview skills workshop. So one of the outcomes for these workshops could be to increase clients' confidence when attending job interviews. And you can see the most relevant domain is the empowerment domain. So the most relevant score is going to be the goal score domain, empowerment. And then for our last example, we're trying to make sure our kids are safe. The most relevant domain is probably going to be personal and family safety. And that's it for step 2. So some of you might be thinking, this is all well and good. How do I remember all of this though? How do I keep track of what outcomes we're achieving and what domains we're using? And how do I make sure that everyone in my organization is reporting the same way? So we have developed a bit of a solution for this, which is the TEI outcomes matrix. So you can use this document to list the client outcomes your service is working towards. So there is a column for the TEI outcome and the service level outcome. And you can also include the score domains that you will use to report the outcomes. I'll show you a completed version of what this looks like as we go through all of the other steps. But I wanted to show you this now so you can kind of see that there is a method to our madness that we're working towards this goal of having a plan to measure and report our client outcomes. So you can see I've already started to fill in the first couple of columns in this matrix for the examples I've been taking you through. So in our first column, we've got the domain, social and community, and then our TEI outcome is increased sense of belonging to their community. Our service level outcome is increased connection to community. And then I've written the circumstance score that we're going to use to measure the outcome. So sorry, I should have said this before. This is for the example for our after school art program. So you can start to see I've mapped out the information that I showed you in the graph earlier. So now we've done step 1 and 2. We identified our client outcomes and we identified our score domain. Our next step is to figure out how we're actually going to measure the client outcome. What tool are we going to use? What questions are we going to ask? All those sorts of things. So there are a number of different options that we have to choose from when it comes to figuring out how you will measure your outcomes. You can use score directly, you can use a validated tool, or you can use your own tool. So I'm going to take you through each of these options now in as much detail as possible. The first one I'm going to take you through is using score directly, which arguably is the easiest option. So there are 2 different ways you can use score directly. The first is to use score as a survey that clients can complete themselves. So there is a document that DSS have developed called How to Use Score with Clients. You can see the hyperlink to the document and a screenshot of what it looks like on the left side of the screen. This resource includes statements for every score domain. So you can see on the screen, we've just got the some of the circumstance domains, but it includes tables like that for every circumstance domain and all of the goals score domains as well. So you can download this resource and distribute it to your clients to get them to answer those questions. The second option is to use score to conduct a practitioner assessment. So you can use your own professional judgment to observe the client, to talk to them, to see how they're going, and you can make a judgment call about where you think they fit on the 5-point scale. So if we think back to the examples I gave you before, you could use the score survey to help you measure these outcomes. So for our after school program, the outcome we identified was increased community connection, and then the score domain was community participation in networks. And then in the center of that screen, I've just got a screenshot from the score survey for the community participation and networks domain. So what you would ask clients to read through those 5 categories and pick the option that best describes them and their situation. The second example we've got in the bottom half of the screen is for the interview skills workshop. So our outcome was increased confidence when attending job interviews. And we decided that we would use the goals score empowerment. And then there's a screenshot for the score survey for the empowerment domain. So again, you would just ask your clients to read through this and select the option that best suits them. So you can see there are little check boxes for the client to complete. So I know these descriptions are quite long and some of them are a bit dense. That might be a bit difficult for some clients to complete. So you can simplify these for your clients if you wanted to make it easier for them. And again, the examples that I've taken you through now are really, really basic ones. If you needed to, you might end up asking clients about 2 or 3 different domains. You're more than welcome to do that. But just remember to only include the domains that are relevant to your activity. So you don't need to ask clients to complete this for all 11 circumstance domains and all 6 goals domains. You just need to pick the ones that are most relevant to your service and get clients to respond to those questions. So the other option, like I mentioned before, is to conduct a practitioner assessment. So this is very similar to what I just went through, but instead of asking the client to complete the survey, you as a practitioner use your professional judgment to determine where they sit on the 5-point scale. So you can do this a number of different ways depending on the activity. You can observe the client, see how they interact with people, how they engage with the activity. You can have a conversation with them and talk to them about what's going on, what they think has improved, what they still need help with. And you can use all of that information to figure out where they sit on that scale from 1 to 5. So our next option is to use a validated tool. So for those who don't know, a validated tool is a survey or an instrument of some sort that is recognized by the academic research community as a valid way to measure what it is supposed to measure. So it's a tool that's gone through a very rigorous process to determine its validity, its sensitivity, and its reliability. So DSS have taken 11 existing validated tools and they have translated them into SCORE. So you can see a list of the tools on the slide, and the little icon next to the name of the tool indicates the type of outcome that they measure. So for example, the Child Neglect Index can be used to measure outcomes in the safety domain. The Personal Wellbeing Index can be used to measure outcomes in the safety domain, the social and community domain, the education domain, and the health domain. So if you wanted to, instead of using SCORE directly, you could use one of these instruments to measure outcomes for your clients. So I'm going to go through a quick example to show you how this works. So this is a screenshot from this document. You can see the hyperlink down the bottom, the SCORE translation matrix. And for this example, I'm going to take you through the Child Neglect Index. So what you would need to do, first of all, is download the Child Neglect Index. So you've got a copy of that tool. And then you would use it to assess the client. So the Child Neglect Index uses a rating scale from 0 to 60, where 0 is adequate, the child's basic needs are being fulfilled, and 60 means seriously inadequate, so the child's needs are not being met in any way. So you use the Child Neglect Index and assess your client to figure out where they sit on that scale from 0 to 60, and then you will take the result of that assessment and translate it into SCORE. So the bottom part of this table tells you what domain to use. So you can see the recommended SCORE domain is personal and family safety. So that's the domain we'll use to record the score. And then it shows you how to translate the result of the Child Neglect Index into SCORE. So if the result is 0, you would record that as a 5 in SCORE. And if the result is anything over 50, you would record it as a 1 in SCORE. So this document, the SCORE translation matrix, has tables like that for all of these validated instruments. So you can use any of these tools to measure outcomes, and then you can look up the translation table to figure out how to report it in SCORE. So if you decide to use one of those tools, you need to make sure you follow the advice on how to use and implement it. You have to implement it as exactly as it's been designed. Otherwise, it's not a validated instrument anymore. If you want to use a validated tool that is not on the list, you can also do that. So in the SCORE translation matrix, there is a blank template that you can use to translate other instruments. So your organization might use a validated tool that is not on the list that I showed you, or you might have your own tool that you've been using for ages and it works for you. And you can continue to use them. And if you want, you can complete this little template to translate your own tool into SCORE. And this will help ensure that everyone in your organization is reporting outcomes consistently. So the last option we have to measure outcomes is to use your own tool. So for those of you who have never measured outcomes before, you can design your own survey from scratch. I've seen a lot of organizations do this. So you're more than welcome to come up with your own survey instrument to measure client outcomes. Or there might be a tool that you've been using for years and you just want to continue using that. So you can do that as well. For those of you who want to develop your own surveys and who may have never done this before, we have developed a guide to help you. So this is called the TEI Guide to Developing Surveys. You can see the hyperlink on the screen. And this document includes a template you can use to develop your own surveys. examples of survey questions you can use to measure client outcomes. There is a checklist to ensure your questions are suitable and will measure the outcomes that you want to measure. And there are examples of surveys to show you what a final one looks like as well. I'll take you through some of the cool stuff in this document in a second. But before I do, I just want to make the point that this tool isn't compulsory. So we developed this as a resource to support you to develop your own instrument if you can't use a validated tool and if you don't want to use SCORE directly. So you don't have to use the information that's in this document. It's just there to help you if you need it. So, sorry, there's some issues with the slides. There we go. So this is what the templates look like. So there are no questions in them. They're just blank. So you can add in. And you can see that we've got two templates, one for a pre-survey and then one for a post-survey. So I'll discuss this in more detail in a minute, but to measure outcomes, we need to ask clients the same questions at least twice. So once at the beginning of service delivery and then again at the end to see if there is a change in your client's response. So we've got templates for both of those surveys, and the post-survey includes satisfaction. So you can make sure that you ask about that at the end of the service delivery. So in order to populate these templates, we've come up with some examples of questions or outcome statements, whatever you may want to call them. Again, I'm having some issues with the slides. There we go. So these are just some screenshots from that guide. So we've got statements for the 7 domains of the outcomes framework, and you can see we've also grouped them by the SCORE domains. So if we look at that health domain in the bottom left, you can see that there are 2 SCORE domains, one for physical health and one for mental health. And then you can see we've got statements for each of them. And they're just really simple. I've got good physical health, I have a healthy lifestyle. And you might not be able to see it very well, but we've done the same thing for the goal score domains. There are a few statements there for each domain. So if you want to use these, you can just cut and paste those statements into the empty templates, and voila, you will have your own survey all ready to go. And again, I just want to reiterate that you do not have to use these statements. You can come up with your own statements. You can use these as inspiration. You can do whatever it is that you want to do with them, so long as they're clear and simple and very easy for your clients to understand. So now I want to show you what this actually looks like in practice. So this is an example of a survey that could be used for an employment skills workshop. So in our pre-survey, we have 4 simple questions. I know how to find work. I have the skills I need to find work. I feel confident in my ability to find work. I know of other services that can help me find work. Now, our post-survey is exactly the same. We need to ask the exact same questions to see if there is a change in the client's response, because that's what's going to tell us if they're achieving outcomes. So the only things we've added to the post-survey are the client satisfaction questions. And then you can see this red table in the bottom right-hand corner shows you which SCORE domains the questions relate to. So the statement, I know how to find work, would go into the goal score domain knowledge. And then you can see the rest of them below in that table. So that's one way that we're trying to help you guys develop your own surveys. So I'm just going to go back to our example that was for the after school program for kids. So the purpose of this activity was to increase community connection. So if you wanted to, you could do something as simple as this, and you could have just one statement that simply says, I feel connected to my community, and that's it. You ask students to answer that question at the beginning of the term, then at the end of the term, and you're done. Measuring outcomes does not need to be an overly complicated or over-engineered thing. I think the best advice I have for anybody who's never done this before is to really just do the bare minimum. And so now we're also ready to update our outcomes matrix, the table that I showed you earlier. So we've already got our first 2 columns filled out with the outcomes that we're working towards for our art program. And you can see I've just provided more information in that 3rd column about how we're actually going to measure that outcome. So we've just written attendees answer question on a 5-point scale. I feel connected to my community. and the result is entered directly into the circumstances score, community participation in networks. So that is step 3 done and dusted, thankfully. Now all that's left is the easy stuff. So we can move on to step 4, which is now we need to decide how to make an assessment. That probably sounds a little bit weird, but I'll explain what I mean. So once you've decided what to use to measure outcomes, what the best way is to administer that tool. So the first one is a client self-assessment. So this means the client completes the survey on their own. You just give them a piece of paper or an iPad, whatever it may be, and they fill it out and they give it back to you. Another option is that a support person could complete the survey on the client's behalf. So if you work with a client with severe disability, a carer could complete the tool for them. You as a practitioner could also conduct the assessment yourself, or you could conduct a joint assessment. So you could work with the client to help them complete the survey, or you could work with a support person to help them complete the survey as well. The approach you take is going to depend 100% on your client and what support they need. I'm sure there are lots of people who you work with who are more than capable of filling out a short survey on their own, but I'm sure there will also be people who need some support from you or from their carer to do this. So please take whatever approach best suits your client on the day you're working with them. The only exception to this is if you use a validated instrument. So if you use a validated instrument, you need to follow the instructions on how to use that tool. So for example, the child neglect index should be completed by a practitioner. The K10 or the personal wellbeing index, they're all self-assessment tools, so they must be completed by the client. So if you are using a validated instrument, please make sure you're following the instructions on how to implement that specific instrument. So this again brings us back to our outcomes matrix. So when you're ready, so we're now ready to fill in another column. This is a little bit out of order, but you can see it's the last column that's titled who is responsible for measuring this outcome. So basically we want you to describe how your tool will be implemented. So I've just written here in our example for our school program, the group leader will ask students to complete the survey themselves. So that's going to be a self-assessment. And then we've also written additional support can be given to students who need it. So there may be some joint assessments that are conducted depending on the needs of the students. Okay, so now we're ready to move on to step 5. Now we need to decide when to make the assessment. So this is another easy one that hopefully won't take too much time. So, sorry, the slides are mucking up again. Okay, so to measure client outcomes, you should conduct at least 2 assessments. One at the beginning of service delivery and one at the end of service delivery. This is because you need at least 2 assessments to see the difference your service has made in a client situation. You could conduct your first assessment at the very beginning of service delivery, ideally the first time you meet with your client. However, we know that this may not always be possible. You have to build a connection with your client for them to feel comfortable. And in those circumstances, you should just conduct the first assessment at the most appropriate time after service delivery has started. The second score assessment will ideally be conducted at the end of service delivery, so on your last session with the client. However, we also know that it may not always be possible to do that because clients can unexpectedly leave services. So you should take that into consideration when deciding when to conduct your assessments. So for example, if you run a 12-week program and there are people who you think might drop out, 1, you should do whatever you can to keep them in the program, but 2, you could also do a follow-up assessment with them a bit earlier instead of waiting till the end. So I know a lot of you don't necessarily deliver clear-cut 12-week programs, and that for a lot of the services you provide, there is no clear beginning or end because you just see clients ongoingly and the support you provide is quite ad hoc. It really just depends on the client and if they need you at a particular point in time. So what I would recommend you do in those situations is pick a time frame that you think is appropriate to check in with the client and do an assessment. You could maybe do it on a monthly basis. Maybe you do it once every 3 months. Maybe you do it every second time you see the client, or every time you see them if you only see them a few times a year. So what you could do is when you meet with the client, check their client record index, look at what support they received previously, what scores were recorded, and have a conversation with them to see if their situation has improved or if it's gotten worse. Maybe last time they spoke to you, they needed help finding accommodation. So you helped them do that and they've been in this great place for 3 months. So you can record that as an outcome. Their housing situation has improved and you helped them get there. But now they're going through a really hard time because they've lost their job. So you could also record that they've got a poor employment outcome. So you might spend some time with them doing up their resume, helping them do some job searches, and then you might not see them again for 3 months. But the next time you see them, you can check in to see how their job search is going. Do you see what I mean? You can kind of take this long-term approach where you can constantly follow up with your clients about the last thing they came to you for to see if anything has changed. And this kind of goes for any long-term service. So say, for example, you deliver counseling, there could be some clients who you've been seeing for years. Maybe they come to you once a month, maybe it's weekly. And again, there might not be any clear end in sight because the client might continuously need your support. So again, you should just pick a regular time frame to assess the client. Do it monthly, every 3 months, twice a year, whatever you think is appropriate. And you can use that information to track their progress to see if they're improving. Maybe you need to try something different. Maybe they need some additional support. Just be careful not to burden clients with too many surveys. Nobody likes completing surveys. So just make sure that the time frame you pick is appropriate for the service you deliver and for the clients that you're working with. Satisfaction only needs to be recorded once at the end of service delivery. However, as clients can unexpectedly leave a service, it might be a good idea to collect satisfaction information more frequently. So you should do what is practical for you and for your client group. So in the example we've been working through for our after school program, this is a pretty easy one because most school programs only run for a term. So they have a clear beginning and end date. So I've just filled out the second last column. When will this be measured, to say the first week of the program and the last week of the program. So now we have a really clear plan that tells us what outcomes we're measuring for our after school program and how we're going to measure them. So you could hopefully give this document to any staff member in your organization and they will know exactly what to do to measure outcomes for a specific activity. Sorry, the slides are stuffing up again. Okay, so a question we get asked a lot is how many clients do you need to report a score for? So the table on this slide shows the proportion of clients we expect you to collect different types of score for. So for circumstances score, you should try to record scores for 50% of your individual clients, and goal score is also 50%. And this is an initial and a subsequent score. So you need to have at least 2 assessments for 50% of your clients. And then for satisfaction, you should try to record that for at least 10% of your clients. So these percentages are quite low because we've tried to account for all of the potential issues you could have collecting follow-up scores. So my advice would be to actually try to collect scores for almost all of your individual clients, because when you start to factor in clients who drop out of programs, who never come back to sessions, who miss the last few sessions, clients who don't fill out a survey correctly, all of the potential issues you could have with data collection, you'll hopefully at the end of the day still be able to have score information for at least 50% of your clients. So try to aim for much more than that, because once you account for all of the potential issues will have, we'll hopefully end up with at least 50% anyway. Okay, so our last step is to record the client outcome in the data exchange. So there are 2 resources that can help you do this. There is a learning module and a task card to take you through the process of adding a score to a client's record. And you can see the screenshots on the right-hand side of the screen that show you where you need to enter the score. So you can see in that first screenshot, we've got our client details, and then we've got the score type. So this is a drop-down menu where you just need to say if the score you're about to record is circumstances, goals, or satisfaction. Then you need to say how the score was assessed. So if you use score directly or a validated tool, and who did the assessment. If you've used your own tool, you need to select score directly. I don't know why. It's just what DSS have instructed us to do. You should only select validated tool if you have actually used a validated tool, like the PWI, for example. And then once you've done that, you need to record the actual score. So on the right-hand side of the screen, you can see the matrix. If you select circumstances score as the score type, it'll show you all of the 11 domains for circumstances, and then you just enter the scores that you collected, the ones that were relevant to the activity that you implemented. So you just use that 5-point scale and select the circle for the option that best describes your client's outcome. So before we wrap up, when you record scores in DEX, the first score that you record and any subsequent scores will only be paired if these key pieces of information match. So it obviously needs to be for the same client, but it also needs to be for the same program activity and service type. And then the outcome type and the outcome domain also need to match. All of those pieces of information need to be the same in order for scores to be paired. I wouldn't stress about this too much because from what I've seen, most people are doing this perfectly anyway. But I would just like to point this out because I know there are some people who have been struggling trying to get their scores to match. And most of the time we realize it's because this information doesn't actually line up. So if you do ever have issues with reporting outcomes, you can check out the client outcomes report in the data exchange. And there are some pages at the end of that report that give you some really useful information about which of your clients have had score assessments recorded. And it'll also show you the domains that those outcomes have been recorded in. So you can see if they've had an initial assessment, and if they still need a follow-up assessment, or if they've had no assessment or something like that. So you can use the information in that report to kind of track if you should be measuring outcomes for certain clients. So here are all of the resources I've showed you today. On the left, we have the documents that we in DCJ have developed. So the first resource, what is SCORE and how can I use it, goes through the 6 steps that I took you through today. So please download that document and work your way through it. It provides a lot more information than what I've discussed, and there's numerous examples in there as well. The TEI guide to developing surveys is also there. So the document I took you through that has our templates for surveys, potential questions you can ask, and examples of surveys as well. And then there also is the TEI outcomes matrix, so the template that I showed you through for how to keep a record of what outcomes you're going to measure and how you're going to measure them. And then on the right-hand side are all of the resources DSS have developed. So that includes the task card and the learning module to use the web-based platform, the SCORE translation matrix for when you use a validated tool, and how to use SCORE with clients if you want to use SCORE directly and use the survey that DSS have developed. And as always, these are all of the different places you can go for help if needed. If you want some assistance developing a survey or some feedback on the approach you're going to take to measure outcomes, please contact the TEI inbox. So you can see the email on the slide there, tei@facs.newsouthwales.gov.au. You're more than welcome to contact us, and we'll be very happy to help you figure out the best way to measure outcomes for your program. If you are struggling using the web-based platform, or there's an issue with your bulk uploads or system transfers, that's when you can contact the DSS helpline. They'll help you with any technical issues that you have using the data exchange. And that's it for today. Thanks so much, everyone. I'll see you in our next webinar on community score.